Welcome to the Health and Wellness Marketplace. Here's your host, Laura Lewis.
Hello and welcome to the Health and Wellness Marketplace. I'm your host, Laura Lewis. Unless you've been living in a cave, you've heard the reports of the threat of bird flu across the globe. Although there is a lot of scare related to the bird flu, the fact remains that it has not yet shown up here in the United States. What does threaten us here is at home is influenza. So today we want to talk about these flu pandemics and some ways that we can boost our immune system naturally to protect us from the flu and other types of illness. Take a look at this graphic. Now, there have been 3 flu pandemics in the past century. The worst in 1918, when more than 500,000 Americans and 20 million people worldwide died. About 36,000 Americans die from regular flu each winter. It will take months to brew a new vaccine against any new super flu. Wow. Joining me today to discuss this topic of a flu pandemic is Richard Lentz, owner of a Seagate company. Richard, thank you for being here.
Thank you.
Now, Richard, when we hear the word flu today, there's a lot of panic associated with it. First of all, where did the word flu originate? Where did that come from?
Well, I wasn't original in developing this, so I brought a slide on this one. It was from the French.
Okay, great.
Influenza comes from the French word influenza, which refers to the belief that epidemics were caused by the influence of the stars. Influenza or flu is an acute respiratory infection capable of sweeping through the entire communities, has very rapid onset, can cause potentially life-threatening complications, especially in the elderly and newborns. This wasn't, we're definitely not having any kind of cure or prevention for flus, but I thought that if we talked about the context of some of these natural remedies and what they might be able to do, and also the influence of people taking antibiotics when they really don't even have a when they have a flu infection versus a bacterial infection.
Because there is a difference.
There's a difference. That if we put it all in perspective, and these days you just can't do a show like this without mentioning bird flu potentials and future bird flu potentials, and there's going to be something else next year growing up in the jungles in Vietnam where people live with their chickens. So we need to face the fact that we're always going to have a disease that's brewing and never have a flu vaccine made fast enough that will combat a mutating organism like a virus.
Now, what do you think about the bird flu?
I think, if we all get worried enough, it's probably not going to happen. And probably by the time this show plays again, it's probably happened and now it's history. However, there's no cost to us in being prepared and knowing what some of the steps that we can take. And we're doing this also as a company at Seagate, both down at the plant and in the office. We're making a plan just in case it happens. From the simplest thing like being extra careful at washing our hands, disinfecting ourselves, not touching other people. Anybody that is sick, sending them home right away. Handing out the nasal spray, the throat spray, just like I use in airplanes now before I get on. If I'm going to be around people, not just in airplanes, but now if I'm going to be around crowds of people, either going on the way to the plant or in the plant or at the office, I'm going to be, if there's a bird flu that's going around, I'm going to be spraying my throat and my nose every couple of hours. I don't know whether it's going to work. Nobody knows whether it's going to work, but most likely the environment that's going to be on my nasal, my sinus membranes.
That's from the olive leaf extract.
Yeah, olive leaf extract, which, according to Dr. Morton Walker, kills everything that it comes in contact with, very likely isn't going to produce a very welcoming habitat for the flu virus. Mm-hmm. So I don't know what else I'm going to do. This is natural, it won't hurt, and spraying it 5 times a day in each nostril and taking a spray down my throat if I'm going to be around other people. And if that bird flu is spreading, and taking a couple of capsules of olive leaf extract to possibly be a natural antimicrobial aren't going to hurt.
Right, exactly. So setting up an environment that's not friendly, whether it's externally or internally, for that particular flu virus to take root and cause all sorts of havoc. So we have to take a break, but when we come back, we'll talk more about this with Richard Lentz right after this. Welcome back to the Health and Wellness Marketplace. I'm Laura Lewis with Richard Lentz from Seagate. We're talking about boosting your immune system against flu pandemics, or actually just flu in general. And, you know, a lot of people, Richard, have a hard time differentiating between like a cold and allergies and the flu. You've brought in some slides today to help us see the difference between cold and the flu virus.
Yeah, I brought them in also because I have a hard time remembering the differences.
Okay, let's take a look.
Okay, cold symptoms characterized by thickening nasal discharge, some sneezing, dry cough, increases with more exertion, mild pain, muscle ache, fatigue, and sore throat. It lasts 1 to 3 weeks. Eyes don't usually become red. That one is generally caused by a virus. And also flu, sudden onset with high fever, headache, severe general muscle aches, fatigue and weakness, lasting sometimes 3 weeks. Cough can be severe, chest pains, occasional nasal congestion, sneezing, sore throat. Flu lasts 3 to 4 days, although, you know, sometimes it can last 3 weeks, as that slide said.
Okay.
And then you have allergies. Also, watery, clear nasal discharge, frequent to continuous sneezing, more than a cold, minimal coughing, red eyes, fewer enlarged lymph nodes than a cold. Lymph nodes, of course, are going to filter out the dead bacteria or viruses, and then they become enlarged, at least on my wife. Occurs off and on throughout the allergy seasons. If you have a cold or the flu, chances are it's not a bacterial infection. People do run and try to get an antibiotic that's going to cure them. Not going to do anything for you. Also,
because antibiotics don't really go after viruses.
Exactly.
Right.
But if you have a really bad flu or cold and then you get a secondary infection where you have a bacterial infection or pneumonia.
And that kind of happens because the mucus hangs around, it stays long enough to someone was describing to me, it's almost like for example in your sinuses, the mucus can kind of stay there and it becomes trapped, and then it's a perfect environment for bacteria to grow.
Exactly.
Okay.
And a lot of times your body, and this happens to me, it can be from a cold, the onset of a cold, or during allergy season. I get polyps in my nose, and the polyps are the body's reaction to trying to keep these allergens or proteins from coming in. It might be hay fever, I have hay fever, or some other allergy that I'm not aware of. I never had allergy tests or allergy shots or anything.
Yeah, I refuse to admit I have allergies, by the way, even though seasonally there's some things that happen.
But you have a lot of the similar symptoms, but much longer lasting, because we'll have during the fall seasons, usually when I get it as a result of grass pollen, tree pollen. I'll start nasal discharge, I'll get red, watery eyes, and it gets so bad that I almost think that I'm sick, but I'm really not. And at the same time, I'll be producing these little polyps in my nose that will, and this is the second stage. When you have an allergic reaction, you have the initial watering and nasal discharge, and then you get the inflammation, because I think what's going on is the body is naturally trying to shut down the membrane, the intake of the air that's bringing in the allergens, and it's closing up the nose. You have these turbinates, 3 of them in each nose.
A turbinate?
Turbinate.
I have not heard of that before.
Yeah.
Turbinate, okay.
Yeah. My ear, nose, and throat doctor and I have gone back and forth on this, because when I get the polyps, I'm trying to decide, do I go in and cut them out, and then by the time I'm ready to cut them out, they shrink again, because the problem that was irritating my sinus tissues goes away. And the nose, let me back up, the nose has really 2 functions. You could breathe through your mouth as well as through your nose, but your nose regulates the temperature of the air coming into your body and the level of humidity, so that if you ever had a really stuffed up nose and you breathe through your mouth at night, your mouth gets all dried out and you wake up.
Sure.
Well, you don't have that when you're breathing through your nose, because the cilia, the membranes, the blood flow through those turbinates regulate the temperature and the amount of humidity of the air coming in, and it doesn't dry out your throat and your vocal cords and everything.
Okay, your body's very intelligent that way. Okay.
Made right. But if you have an allergen, the second stage after your body becomes sensitized to it is it becomes inflamed. Those tissues in the nose expand and try to block the breathing so that you don't continue to get that allergen in your body. And it's just your body's natural way of shutting down, and a polyp can be created and do what you mentioned earlier, close down entirely the flow and discharge of mucus from your sinus cavities. And as a result of all that, long story, you get a bacterial infection.
Well, what would you recommend for a cold or allergies in general relative to prevention or even treating, the symptoms?
Well, who knows whether or not Dr. Morton Walker believes that the olive leaf extract kills
olive leaf extract, okay,
kills viruses. I don't know. I take it anyway because it doesn't hurt when I get the first sign of a cold, because I believe that even if it's not killing that flu virus or a cold virus, that it's helping to irrigate the sinuses and keep it from getting that clogged up, that I get a secondary infection. And very likely it is helping not to allow an environment where those bugs are going to be reproducing at such a rate that, I get a terrible cold that's going to last for 3 weeks.
Right. It's like, to my mind, a visual is like an engine that needs clean oil and things are moving along nicely. You want to keep the body up to speed as well, keeping your engine tuned up. And one of the ways you can do that is with the olive leaf extract. That's what you're saying. We've got to take a quick break, but when we come back, I'd love to talk a little bit about some of the products you have that can help ward off some of these uncomfortable symptoms and help keep us healthy. Okay?
Okay.
We'll be right back with Richard Lentz. Welcome back. Have questions about how to prevent symptoms of allergies, colds, those kind of things. We're talking with Richard Lentz of the Seagate Company. And you're a farmer and a fisherman. And you do have some products. Specifically, I know that your origin was shark cartilage, but also the olive leaf extract and how that relates to boosting the immune system, that kind of thing. I mean, really, honestly, it's one of those things you go, well, you have a cold, go have some chicken soup, go get some rest, drink plenty of fluids, but there are other things you can do to actually help your body fight off infection.
No, exactly. It's hard to diagnose exactly what it is you have. Is it a cold? Is it a flu? You got to, go back to the show if somebody taped it and look at those different symptoms. Are your lymph nodes swollen, or do you have a fever, or figure it out. But with the olive leaf extract, it almost doesn't really matter if you don't figure out what you have, because it's probably going to help you anyway. And if it doesn't, it's not going to hurt you. It's not going to be like a Viax or a Celebrex or something where you have a side effect. In the years that we've been manufacturing it, since 1998, we haven't had a single case where anybody's called back and said they had an adverse reaction or problem. Can you imagine if the FDA ever heard that, God forbid, that olive leaf extract caused somebody to go into the hospital for who knows what? They would be on top of us in a moment. First, they would check and see whether that was a legitimate reaction or somebody just trying to come up with a lawsuit. But if it were a problem, and if this were an over-the-counter drug, they have this big tolerance for reactions that are, contrary to,
they're going to expect some reactions from a prescription, whereas they would have very low tolerance of some sort of natural supplement that might cause something.
And there's a reason for it. Olive leaf has been in our food chain for thousands of years. We've been eating olive oil, we've been eating leaves, and this is not something that's suddenly introduced as a drug. This has been part of the food chain. This is why it doesn't kill the natural flora, bacteria, and inhabitants of our gut, because it's not a
chemical.